Hello, this is Dr. Subrata Chakraborty, consultant endocrinologist based in Kolkata. Now, I'll be sharing with you some tips regarding management of diabetes and its complications. Now, first things first, let us not forget diabetes mellitus happens to be one of the most common pandemics in the non-communicable disease category, with nearly 400 million adults suffering from it. In the year 2019 alone, there were 1.6 million deaths, most of it arising due to the notorious macrovascular complication, cardiovascular disease, and the equally deadly microvascular complication, chronic kidney disease. So, blood glucose management is of paramount importance, but alongside, we should take into account the management of micro and macrovascular complications. To put things into perspective, type 2 diabetes mellitus happens to be one of the leading causes of cardiovascular disease worldwide, and cardiovascular disease in its turn has become the leading causes of morbidity and mortality in diabetic individuals. Alongside, diabetes mellitus also happens to be the sole leading cause of chronic kidney disease, including end-stage kidney disease worldwide for the last couple of decades. Prevention is better than cure, and seldom is this fact better exemplified in the case of type 2 diabetes mellitus. So, we can drastically curtail the development of type 2 diabetes mellitus by engaging in active lifestyle, taking a balanced, nutritious diet, taking more of green leafy vegetables, whole grains, pulses, lean fat dairy items, and other fruits and vegetables in ample amount, and cutting down on the salt intake, cutting down on the refined sugars and processed food, as well as cutting down on the alcohol intake and quitting smoking. All these parameters, all these efforts, if combined in the long term, can go a long way in reducing the chances of development of type 2 diabetes mellitus. But what to do if an individual has already developed type 2 diabetes mellitus? In such scenario, we need to curtail the risk of development of micro and macrovascular complications. The microvascular complications typically refer to the development of nephropathy, neuropathy, and retinopathy, and the macrovascular complication, as you might have guessed rightly, the development of cardiovascular disease, cerebrovascular disease, and peripheral vascular disease. Now, to reduce the development or to reduce the progression of these complications, we need to remember that blood glucose management alone is not only sufficient. We also to take into consideration the avoidance of other risk factors which drastically increase the chances of progression of these complications, taking into account the blood pressure control, favorable modulation of the lipid parameters, avoidance of nephrotoxic agents, regular follow-up with the healthcare practitioners, at least an annual retinal checkup, getting the foot care examination done on a regular basis. All these things go a long way in reducing the chances of development and progression of micro and macrovascular complications. So, on the eve of this World Diabetes Day, my message would be stay active, eat healthy, and remain stress free. Thank you.